it's Dr. Gura over at Northeast Chiropractic Center. Today I just want to talk about gut health and kind of metabolism with you. So one of the major things we see in the office here is patients that come in that have kind of an insulin resistance. So basically what that means is that you have a high blood sugar. When we have a high blood sugar, our body likes to store fat kind of around our belly and abdomen here, which then therefore puts a lot of stress on the lower back, causing us some lower back pain. So the second thing I want to discuss with you is just kind of gut health today. So when we have bad gut health, our body's not, digesting and absorbing the nutrients as good as possible. And when that happens, our body likes to store that as extra fat. But then it also increases our craving, especially for inflammatory things such as sugar. But the major research anymore in gut health is actually leading us to chronic inflammation. And so when we have chronic inflammation, that's going to lead to a lot of stiff, achy joints, but also it's going to increase our inflammatory levels and cause greater amounts of sickness with things such as diabetes, heart disease, and potentially some autoimmune conditions. So how can we help you at Northeast Chiropractic Center? We're going to look over your gut health, kind of your inflammatory scores, maybe a little bit of your diet, as well as look at kind of your movement and exercise patterns. So just some things that we can kind of work on at home in between appointments, right? So first is eating a more balanced diet with more whole foods as opposed to processed foods. So when we eat processed foods, a lot of times I know that's more convenient for us in our busy schedules, but that's more inconvenient for our gut. The second thing that we can work on is just intermittent fasting. So what is fasting good for? Fasting is good for kind of helping burn more fat. It's going to help increase, the insulin sensitivities that we discussed before, but also just kind of help our metabolism overall. So kind of a good starting point for that would be to try fast over like a 12-hour period. So a good example with that would be, not eating anything after 7:30 p.m. at night, and then not eating anything again until after 7:30 a.m. the next morning. And then the last thing is just kind of looking at our exercise levels, right? So just increasing our cardiovascular health, just getting out, getting some blood flowing, maybe go for a nice jog or walk around the neighborhood. But then also looking at, adding a little bit of strength resistance training as well, as that's going to help build our muscle mass. And with our body burns fat better with muscle than it does excessive levels of fat at rest. So more calories are burned when we have more muscle than we do fat. So if you're struggling with any of these things, the chronic inflammation, the gut health, or some digestion issues, gut health, anything along those lines, please give us a call today at Northeast Chiropractic Center. We'd love to assess these things for you and get you on a plan tailored to you to help you become the best version of yourself.